Please call the next speaker, Dr. Arpit Shah. He is going to talk on snare the cataract. I think by mistake in program it is printed snare the 6 minutes, but don't snare your 6 minutes.
Yeah. Yeah. And since Dr. Nitin Verma is yet to come, we will have some time for discussion. So please have your questions ready.
Good morning, everyone. At the outset, I would like to thank Dr. Boramani sir, Dr. Sahu sir, ISMSICS and AIOS for giving me this opportunity. So I'll be talking about snare technique. So importance of this technique is incision size is close to phaco incision, which is slightly larger than that, but 3.4 mm incision is there. Parts of the snare, it has two needles used. First needle is acts as a body. Second needle is handle, which are the 18 gauge steel needles. It has two tips in the front, which is a very important part of it, and it has a 36 gauge steel wire. So unique about Dr. Anil Shah's snare is it has two holes at the tip of the needle. Is a magical concept that allows rotation of the loop inside the anterior chamber when the handle rotated externally without collapsing AC or displacing the nucleus. Loop size can be adjusted to engage the nucleus according to its size by pushing and pulling the handle of the snare without damaging intraocular structures. Sharp inner cutting wire divides hardest nucleus easily. Any grade of cataract can be managed using this snare. Smooth movement of the loop as very thin wire passes through a very big lumen. Few points to be remembered when you are new and when you are using the snare is appropriate size tunnel. That is external lip should be 3.5 to 4 mm. So don't extend it initially. Only if you require that snare technique is not working in your hand in initial stages, then you later on extend and then do it your routine technique. But initially when doing snare, trying snare, go for 3.5 to 4 mm incision. Free floating nucleus in AC is must. Cohesive viscoelastic substance like sodium hyaluronate all around the immobile nucleus. Coat wire loop with the visco to protect endothelium. When entering tunnel, loop size can be made smaller by pulling the handle. Once the tunnel is crossed, the loop size can be adjusted to the size of nucleus by pushing and pulling the handle. Anterior posterior size of the cataract is around 3.5 to 4 mm approximately. Large loop can damage the tunnel, corneal endothelium, iris and PC. Small loops fail to engage the nucleus. Snare loop size should be adequate to engage the nucleus. So bisection or trisection can be done depending on the size of the nucleus. Hard nuclear fragments removed by McPherson forceps, 11 mm long APA McPherson forceps. This is the number. There is no financial interest, but we are, Dr. Anil Shah is using this, and even I am using this since long time. This gives better grip to the nucleus for removing it. Soft nucleus fragments can be removed by 2 mm Vectis. We are coming out with a small modification in the snare. So contraindication for the snare if eyeball is hard or no hypotony, if nucleus is not free floating in the AC, if anterior chamber is not filled with viscous, if AC is filled with saline or BSS, don't attempt snare using snare. If ocular movements are present, never use snare with when AC is filled with BSS or RL. That is one important point.
Dear colleagues, this is my method of doing manual small incision cataract surgery with snare. I preferably use transconjunctival limbal tunnel incision. Usually the incision size is 3.5 mm to 4 mm. After prolapsing the nucleus into the anterior chamber, use adequate visco so as to immobilize the nucleus. I preferably use sodium hyaluronidase so it makes the nucleus stable in the anterior chamber. When you are using snare, make the loop smaller than the size of the incision. As you cross the tunnel, increase the size of the loop according to the size of the nucleus. The trick behind snare technique is engaging the nucleus. If you do this properly, then you can master this technique very easily. Always pass the loop obliquely in the angle. One arm of the loop goes above and one arm of the loop goes below. And after engaging the nucleus, pull the handle so as to divide the nucleus into two halves. You can do bisection and trisection with snare, and any grade of cataract can be removed easily through 3.5 millimeter incision. This is white intimation cataract, in which the bisection is done with the snare. The main advantage of snare is that when the bisection is done, the loop becomes smaller. So it is away from the endothelium, it is away from the posterior capsule and also from the iris, and it doesn't cause any damage to the tunnel. So that way it is least traumatic in the anterior chamber. Now this is a hard cataract, grade 3. Here I will show you how the trisection is performed. One arm goes below and one arm goes above, and engage the nucleus and divide it into one piece. Now the nucleus is rotated, and again another snare is used to engage the nucleus, and a division is completed. So here the trisection is done, and these nucleus are easily removed by McPherson forceps. I prefer McPherson forceps over Vectis. It doesn't cause any damage to the endothelium. Snare should not be used in hard when the eyeball is hard, when the eye is moving, and when there is a high intraocular pressure.
Thank you so much. Thank you.
Thank you, Dr. Arpit, giving us the beautiful picture of the snares. So I think very simpler in the hands of the, masters. But in the beginning, probably we may land in complications. But however, one has to learn the technique. This is a very important technique because we are in India, we get a lot of hard nuclear cataracts. If you can break the nucleus in 2 or 3 pieces, it will become easier to take it out in the 3 to 4 millimeter section.